Hi everyone, my name is Yanchun Zhao. This is my presentation that was prepared as part of HAP 725 Statistical Process Control taught by Dr.Alemi in George Mason University. This presentation will discuss the comparison of hospitals' performance, specifically INOVA FAIR OAKS Hospital on multiple indicators based on heart attack patients when compared to its competitors. The source of the data is from data.cms.gov. The hospital compare archive datasets were used to create the performance comparisons. I chose data from 2015 to 2019, total 5 years. The limitations of this data include missing values, which some facilities didn't report or collect some data. There are numerous measures to compare to, but only 5 were selected. Also, we use 95% confidence interval to analyze our data, so there is a 5% error rate. The competitors to INOVA FAIR OAKS Hospital I chose are INOVA London Hospital, Reston Hospital Centre, and Novant Prince William's Medical Centre. The reasons why I chose these hospitals are because the size of the hospitals is similar with each other. Also, there are local hospitals in this area. It may help our residents to choose which one is the best for them to go. The measures we'll be calculating are patient satisfaction rating. The measure ID is HCAP6 linear score in our data. Second one is 30-day death rates. Measure ID is MORT 30 AMI. Third one is outpatients who got cardiac imaging stress tests before low-risk outpatient surgery. The measure ID is OP13. And fourth one is acute myocardial infarction 30-day readmission rate. The measure ID is readm 30 AMI. The last one is payments for heart attack patients. The measure ID we use is AMI. Based on our data analysis, here is the result for each indicator. The first indicator is patient satisfaction rating. As we can see, patient satisfaction rate in INOVA FAIR OAKS Hospital were outside of the up control limit in 2015, 2016, 2017, 3 years, compared to competitors. It means patients were more satisfied with INOVA FAIR OAKS Hospital than competitors in these 3 years. Other 2 years were within control limit. The second indicator is 30-day death rate for heart attack patients. From the control chart, we can see all of these 5 years were in the control limits. It means 30-day death rate is under control compared to competitors. The third indicator is percentage of cardiac imaging stress tests. As we can see, because of the data is missing in 2014, we couldn't calculate it. The percentage of cardiac imaging stress tests in other 4 years in INOVA FAIR OAKS Hospital were within control limit compared to competitors. The fourth indicator is 30-day rate of readmission for heart attack patients. From the chart, we can see the rate of readmission in INOVA FAIR OAKS Hospital were within the control limit, and no concern about that compared to competitors. The fifth indicator is payment for heart attack patients. Based on the chart, we can see from 2014 to 2017, the payment for heart attack patients were within control limit. But in the year of 2018, the payment for heart attack patients were outside of up control limit compared to competitors. This may need our attention. In summary, compared to competitors, patient satisfaction were more satisfied in INOVA FAIR OAKS Hospital in 2015, 2016, 2017 3 years. 30-day death rate for heart attack patients is under control. Outpatient cardiac imaging stress test score remained within the control limit, also no concern. 30-day rate of readmission were within the control limit and also no concern. Payment for heart attack patients were outside the up control limit in 2018, which need our attention. Thank you.